Hello, I am Dr. Robert Schwartz, an electrophysiologist with the Norton Heart and Vascular Institute. Lead extraction is a procedure to remove previously placed pacemaker or ICD leads. The leads are removed for a variety of different reasons, including leads that malfunction, leads no longer needed, infection of the leads, or the need to obtain access to the heart when the vein is blocked by scar tissue. Over time, leads placed into the body develop fibrous scar tissue between the lead, veins, heart, and other leads. This scar tissue will increase with time and prevents the easy removal of the leads. As the binding of the scar tissue increases, the difficulty in removing the leads increases and may require the use of special tools and techniques. There are a number of different techniques for removing leads. The most common approach is to open the area in the chest where the generator portion of the device is located. The portion of the lead or leads in the pocket are then freed from the surrounding scar tissue. A special type of wire, called a lock-in stylet, is inserted into the lead and locked into position. Next, a tube with either a cutting blade or laser at the tip is placed over the lead and the lock-in stylet. The tube is moved over the lead, as if you were placing a straw over a taut string. As the tube encounters scar tissue, it cuts or lasers the tissue apart, allowing the tube to advance to the end of the lead. Once the lead is freed from the tissue attached to it, it is removed. The decision to remove leads, like any procedure, is a balancing of risk versus benefit. The discussion of benefits and risks for a particular situation should be reviewed with a care provider. If the decision is made to proceed with lead extraction, here are some of the things to expect. The night before the procedure, patients cannot eat or drink after midnight. A blood thinner, medications will have to be stopped a few days prior. These instructions will be specific to what type of blood thinner you are on and will be communicated to you from the office. The morning of the procedure, you will need to arrive early. Blood tests will be checked and an IV will be placed in the preoperative area. For leads that have been in for a period of time and develop fibrous scar tissue making removal difficult, the extraction procedure is often done with general anesthesia and an anesthesiology provider will be present during your case. In addition to the electrophysiologist performing your procedure, we will also have a heart surgeon and his or her team on standby in case additional support is needed. In most circumstances, small flexible tubes are often placed into the groin to assist with the procedure. These are usually removed before the end of the procedure, but there will be bandages over the groin. After the procedure, patients generally have more pain and soreness than the initial device implant because more work is done in the body than during the initial implant. Patients generally stay in the hospital overnight and are discharged from the hospital the following day. Care must be taken to avoid overuse of the affected arm. Patients will need to refrain from working and physical activity for a period of time. This will be discussed with specific instructions prior to discharge from the hospital. Be sure to review pre- and post documents on what to do before and after the procedure. As always, if you have questions, please reach out to your doctor's office. And once again, thank you for choosing Norton Heart and Vascular Institute.